Welcome to the first speaker session of day 4. For those that have been with us throughout the duration of Congress, we hope that you're feeling informed and inspired by hearing about the impacts of the digitalisation of healthcare. My name is Jessica Pacey of 67 Health and part of the Data Saves Lives team here at EPF. Over the next hour, we're going to be exploring the road to patient empowerment through data and digital health literacy. The first part of the session is pre-recorded, but we're taking your questions live, so do send them through in the chat function and we'll be picking them up in 40 minutes time. So specifically, what do we hope to leave today's session with a better understanding of? Well, 2 key areas. Firstly, how we can improve digital health data literacy in collaboration with a variety of stakeholders, many representatives of which we have here today. And secondly, how responsible health data sharing can lead to improved health outcomes and healthier populations. And we'll achieve this through a combination of expert speaker presentations, an illustrious panel discussion, and an open Q&A with you, live, our audience at the end of the session. Before we hand over to our first speaker, we wanted to introduce the Data Saves Lives initiative. Health data sharing is a complex area and one that is evolving at an extraordinary pace. As you've heard about over the last few days, the process has been transformed by the introduction of new digital ways of storing, exchanging, and analysing data. Incredibly, more scientific data has been generated in the past 5 years than in the entire history of mankind. So it's no exaggeration to say that the wealth of data has potential to transform public health. To truly harness the power of health data, it needs to be shared and used effectively. It's our mission at Data Saves Lives to make this a reality, and since 2019, we've been spreading awareness. How do we do it? Here's a short summary film to explain more.
Data Saves Lives is a multi-stakeholder initiative led by the European Patients Forum, EPF. And our aim is to spread the word about the benefits of responsible health data sharing and to improve health data literacy among patient communities. Healthcare is rapidly advancing thanks to the power of health data, the key that's unlocking a better future for all. But many people may still be wondering about the basics, like what is health data and why is it so important? Over the past 2 years, we have developed a range of resources to equip people and organizations with the tools and knowledge to better understand the answers to questions like these. This includes information sources on our website, regular online events, health data case studies, new updates, blog posts from experts in the field, and our new patient group toolkit. We have a strong social media presence, hosting regular web events such as tweet chats and webinars, putting together the knowledge of a range of healthcare, patient, and industry experts. Through facilitating such discussions and debates, we hope to contribute to the growing discussion on the power of health data and its transformative potential. So why should you support Data Saves Lives? When used safely and effectively, health data could become a key basis of effective healthcare. Through education and campaigning about its benefits, long-lasting positive change can be brought to the lives of patients and their communities. We will all benefit, from individuals to healthcare systems and even global populations, from the safe sharing of health data, and we want to harness its full potential. Do you?
So that sets us up very nicely to hand over to our first speaker, one of our beloved Data Saves Lives editorial team members. Birgit Bauer is a journalist, social media guru, and digital health expert, analyst, and speaker. A force to be reckoned with, she has been instrumental in the launch of our new toolkit to help patient groups spread the word about how data saves lives, and it is my pleasure to give the floor to Birgit now. Birgit.
Hello, everyone, and thank you, Jess, for the kind introduction. My name is Birgit Bauer, and I'm coming from the Toolkit Pilot Group. I'm the chair of the people. As you can see, we have developed a toolkit building on the insights from our end of the year 2020 workshop. We conducted a survey among regional, national organizations to prioritize suggested tools and resources needed to initiate and implement health data communication and sharing initiatives locally. We have now developed the first iteration of the toolkit with a variety of tools and also resources, acknowledging different levels of resource sophistication of patient groups and patient influencers. And that is important because the toolkit now is available via the Data Saves Lives website and will work with patient groups to help translate to the resources for the truly pan-European use. And as you can see, the initial content is from an introduction about explaining how Data Saves Lives is guided, also a guide to use digital health tools, which is much important. Also the DSL general communications guidance, because sometimes we have seen that communication is a key point in explaining how data saves lives or how data can save lives. So have a look at the website and have a look at the toolkit, because it's there, it's launched, and it's usable at the moment. So, and on the next slide, you can see the ambitions for increasing our impact in 2022. We want to drive the discussion and engagement through social media, tweet chat, and webinar series. Maybe you know them already, and they are very famous at the moment because we deliver and provide valuable information about that. We also want to launch a Data Saves Lives Toolkit version 2.0 to equip advocates to carry the torch. Also, we want to support next generation of Data Saves Lives ambassadors through a dedicated training bootcamp. And also, we want to continue to update website with blog, case studies, and patient stories. And that's it for myself. Thank you for your attention.
Thank you so much, Birgit. And I look forward to coming back to you with any questions during the live session towards the end. Now, the toolkit is just one of the ways that we're hoping to make the topic of health data more accessible. And we are delighted to be joined by health literacy trailblazer and globally renowned experts on this topic, Christina Sorensen, who's going to explain a little bit more about the concept and how we can champion improvements that enable people to better access and understand information, which can in turn empower them to take an active role in the self-management of their care. Christina, over to you.
Thank you, Jessica, for the kind introduction, and it's my pleasure to be in this session today on empowering patients through data literacy and digital literacy. And I'm the president of International Health Literacy Association and founder of the Global Health Literacy Academy. And my job today is really to set the scene and introduce you to the concept of health literacy if you're not yet familiar with it. Health literacy is the knowledge and motivation and competencies to access, understand, appraise, and apply information in everyday life to make decisions regarding healthcare, disease prevention, and health promotion to promote quality of life during the life course. It sounds as a technical definition, but really what it is, it's about being able to find information and understand what you read, for example, in the media or on the internet, and judge if this is relevant to you, and then to apply the decisions that you have made, for example, making an appointment or listening to your body to find symptoms and then go to your doctor when it's needed. And we also say that in this definition that health literacy is not an end in itself, it's really a means to quality of life. And we can regard it also in the digital sphere. So I'm not only talking about what the doctor is telling you, but really also when you're on social media or listening to the news, what we have seen, particularly in the time of the COVID-19, where we had to learn a lot of new things about a new disease and how to take the right measures. What is important to understand, especially in this session, is that it's two-sided when we talk about health literacy and digital health literacy and data literacy. On one hand, it's about people understanding their own data or getting access to data and understand it. On the other hand, it's how we as professionals and organizations and service providers are sharing the data with our patients and how we can make it less complex for them to actually use. So it's two-sided. On one hand, the skills or the health literacy or digital health literacy, data literacy of our patients and how they're empowered to deal with the data. And on the other hand, it's about how we, from a system point of view, deal with this data and make them available in an appropriate and timely manner. I want to introduce this model, and while it may seem a bit complex, I think it's helpful for us to understand how is health literacy actually perceived as a dynamic concept. So as I said, it's about accessing, understanding, appraising, and applying information to take decisions, as you see in the circle in the middle. And it's actually influenced by personal factors, about situational factors where you live, love, work, and the wider societal factors, so countries where you live in. This could be, for example, about regulations and law regarding access to your own data. I live in Denmark. We have a highly technological system regarding our health, and I can access most of my own data and share it with the general practitioners, but I know this is not the case in many European countries. On the other hand, here on the other side, you see that in turn, health literacy also influence how we use health services, and therefore also the health costs. Sometimes we underuse, sometimes we overuse, or we see people overusing systems. It has an influence on health behavior and health status, and also how we engage. And this is particularly important with the topic we discussed today. Are people able to engage based on access to data? And how are they being empowered? And then, unfortunately, we see a very strong social gradient that shows us that there is inequity in this area, where those with low health literacy often have low education and also low health status, and therefore have a triple burden to carry. Whereas those with many resources also often have many more high health literacy. And in fact, actually, this can influence trust, because those who are highly health literate may also be able to see where all the flaws are in our systems and start questioning this, and that might impact also the trust. So this could be an issue to discuss for the panel. We see that health literacy develop over lifetime. So you start when you're a kid to learn to brush your teeth and do some exercise in schools. And then as teenagers, you learn not to drink too much and not start smoking. And as adults, we learn to not have too much stress. And as elderly, we try to have active and engaging elderly citizens. And when you get ill, suddenly you might have to get to know about cancer or diabetes or any other treatment. So it changes. It's a dynamic concept, and it's content and context-specific concept. But let me move away from this more technical and theoretical description of health literacy and tell you that we want to see health literacy as an asset, not only a burden about not having a lack of health literacy, but really as an asset, because it increases health status. We know from our research that it decreases the many times you have to go to hospitals. It increases how people are engaging in preventive measures, such as, for example, vaccines or wearing masks or keeping social distance. And it increases also quality of care, because if you are informed, you are also able to judge if what is informed to you or the information you're dealing with actually fits the needs. And it increases, as I said, active participation and patient engagement. So I look very much forward today to discuss with our colleagues here in the panel what can we do to lower barriers from a systemic point of view so that our people and patients are getting more empowered and using their data in an appropriate manner and a timely manner? Thank you.
Thank you, Christina, for illuminating so much in such little time. I'm glad that we have you as part of our wider panel discussion now to explore some of the points that you raised in greater depth. Before we do so, I just wanted to give a warm welcome to the rest of our expert panel representing patient organisations, the clinical community and policymakers to give a broad range of insights across health data literacy and health data sharing as our topics of the day. Now, we've heard enough from me today, so I'd like to invite you each to introduce yourselves and your organisation, if I may. So, Nick, may I start with you?
Sure, thank you very much, Jess. My name is Nick Schneider. I'm the head of division for new technologies and health data use. I'm a physician by training and a patient by nature. My unit is in charge of regulating and promoting trustworthy health data use on national and international level, and that's why I'm very pleased to be here in this audience, or this panel.
Thanks very much, Nick. And Ange, can I come to you?
Yes, of course. Hi, everyone. So my name's Angie Bradshaw. I'm a project officer at Alzheimer Europe, and Alzheimer Europe is an umbrella organisation of national Alzheimer's associations. We have 37 members across 33 countries. We want to aim to change perceptions, practice and policy and make dementia a European priority. And from the data and digital health perspective, we've got a strong interest in that area. We collaborate on several large EU research projects and initiatives, as well as Data Saves Lives. I'm very happy to be here.
Thanks very much, Angie. And our last panel members, we obviously have introduced Christina previously. Aleš, over to you.
Hello, everybody. I'm Aleš Borek. I'm based in the Czech Republic. I'm fortunate enough to be able to serve the patient community as a gynecologist because I have a center for assisted reproduction. But at the same time, I have the privilege of mentoring future colleagues at the medical faculty of the Masaryk University as the head of the Center for Healthcare Quality.
Fantastic. Thank you, Aleš. Well, we're so privileged to have you all with us today. My first question for the panel really picks up from Christina's presentation, and this one I'd like to direct to our community representatives. So, Andrew, this one's for you. Why is it important for patients and caregiver communities to be literate in health data and digital health?
So I think a central tenet for us anyway is nothing about us without us. So as Christina mentioned very eloquently in her presentation, patients really need and want to be meaningfully involved and participate in their care. And health and digital literacy are really key enablers of this. So if we have good health and digital literacy, it means that we can understand diagnoses, understand conversations with our practitioners, and also make the best decisions, the best informed decisions on the ways in which we can manage our own health and care. And from a research perspective, what we see coming across the horizon is an increasing number of projects that are looking at AI-based tools for risk prediction, for diagnosis, and potentially also for care. So it's really important that patients and the public are empowered to understand these new developments as they translate to the clinical practice.
Thanks, Angie. So many good points raised there. Before I ask the next question, on that point in terms of all the great work being done, where do you think we are in the spectrum of where we need to be for health data literacy? And it could just be in the dementia community, if you'd like to provide that perspective, but just as a kind of temperature check for where we're hoping to get to with Data Saves Lives.
I think a temperature check is a really good analogy because we live in a really diverse continent and temperatures vary across that continent. Currently where I'm sitting, it's sunny but cold. It's very warm in Spain. So equally, levels of digital and health literacy vary hugely across countries, but also within communities. And it's very difficult to provide a single answer to that question, just as it is difficult to create single initiatives to meet everyone's needs. And that's why it's so important to get everyone around the table and to really understand what the enablers are, because for each community and for each individual, they will be different.
Quite. And I think that the pandemic, for better or worse, one of the silver linings of this awful global challenge has been that people have been talking about health data more and what we can do to share information cross borders. And for that, actually, let's come to you, Nick. Obviously, in your introduction, you're a man who wears many hats today, speaking from more of the policy perspective to us, but would be really keen to understand from you what you see as the biggest challenge facing cross-border sharing of data.
Well, I think we all agree that the biggest challenge at the moment is still the regulatory environment. In the EU, it's very easy to transfer money, to transfer goods, to move as a person, even to move as a professional. But somehow data still stops at the border. Data is still stuck to national regulatory systems. And I think for us, the European health data space is actually the silver lining, which we are seeing. It started to be developed before the pandemic, but I think the pandemic has become a catalyst to demonstrate how relevant it is that we actually share data. And I do see that with the corona warning apps, with the digital certificates for COVID-19, we get a notion of what can be done if we provide enabling environments with citizens, with patients, for citizens and patients when it comes to health data use. And I think it's important for us to really grasp that chance we have right now. And I do see that this is the time to really sit together, healthcare professionals, patients, citizens, and regulators, to define how we want to see the European health data use to develop in the next couple of years. Because we do have other systems out there which are either moved by purely monetary senses or by a rather authoritarian systems. And I do think it's time for us to develop our European way, which is built on values and build on trust. And I think trust is going to be key, and health data literacy is going to be the tool which we need for that. And I think that's why the toolkit is so important, to really bring this message to our citizens, to our patients on the ground. And I think we also need to move out of the Brussels bubble. I think we are all debating this on a European level. That's very good and needed. But in the end, we need to reach the patients on the ground. We need to reach each member state, have it in their language, because they are the ones who are going to be the best advocates to share data, to use data. Because in the end, talk about electronic health records. If a patient doesn't use electronic health record, data is not going to be shared. So I think this is the key which we need to reach, is that we need to build those enabling environments. In a certain way, I see the health data infrastructure we need as a digital infrastructure similar to a road or train system. We need to have those different vehicles to go from one country to the next. It's easy to travel by train from Copenhagen to Berlin to London. We are connected. Health data is not connected yet. But we need to see that the ones in the driving seats are going to be the patients, the citizens, which have control over the data. And I think we have to enable that. I think that's something which we as regulators have to ensure. And I think to give that trust, we need to give the data to the patient. And the patient should decide what to do with that data. In Germany, we introduced last year a regulation which enables the donation from health data out of electronic health records to a federal data research center, where it's then being trusted and upon permission granted access. Similar system we have in Denmark and Finland and France. So I think this is going to be the future. And I'm having high hopes for the regulation on the European health data space, which is expected for early next year, to really ensure that we get a common European health data space.
Thank you, Nick, and what a great goal that is. I love the analogy there of seeing health data sharing like transport, where we have links making that same infrastructure there. Christina, obviously you've been pioneering in this space for many years now. What are the biggest opportunities that you've seen in the last 12 months to further this conversation and some of the ways that Nick has been describing?
I think we have really seen a boom in new technologies, and most people have quickly been able to adapt to those new changes. And the digital era is here, and the new generations, they can really well use all the digital technologies. But of course, we have groups that are still struggling, which we need to make sure that we have design solutions for them so that they are still included in our society, and that we are not, from a systemic point of view, creating barriers or challenges for them so that they feel excluded. This could be, for example, elderly, or if you are an expat or migrant and not understanding any languages. So that's where I see some challenges. Also, I should mention that our health literacy research has shown that 1 in 3 actually on daily basis find it difficult to navigate the complex information jungle. And that's, again, something we all need to take into account. And I think it's everyone's responsibility to help lower barriers.
Thanks, Christina. I think that's a really good point. It is a jungle out there, as you say. So a lot of the work that we do here at Data Saves Lives is thinking about who has that responsibility to provide that education and make it easy. And as you say, it is everyone, but there are some people who have that greater exposure to make that impact. And of course, healthcare professionals are on the front line of interacting with patients and people affected by those conditions to help them along the way. Alice, I wonder what your perspective is in terms of the role of healthcare professionals in educating patients about how they can use their own data and how they can collect it.
It's always interesting to come after colleagues that have presented most of things and that have discussed already a lot. But from my point of view, health and healthcare is about collaboration. None of us has the capacity to do these things alone, and nobody expects us to do this alone. Now, if we are supposed to efficiently collaborate, then we have to efficiently communicate. And what has happened with the change from the industrial society into the information society that happened around the turn of the century is that we have found a more precise way of communicating. We have gone digital. It's basically the same as using Morse code. So we are able to share information without having information noise and information background hinder our efforts. Now, even though we have these technologies for the last 20 years, we have still not implemented it. 20 years ago, I've heard people saying we're going to have a paperless office, and we actually ended up having more paper in office than we had before. And from my point of view, the most interesting thing that we have to accept is that for the first time in human history, the majority of us is working with tools we don't really understand very deeply. So it's nice to have tools on the market, but without deep understanding, we might have unexpected side effects of using the tools. If somebody used the hammer and he did something incorrectly, he got immediate feedback. I hit my finger, it bleeded, it hurt. If I use a digital hammer, I may not be aware of the potential side effects. And none of us, with the dynamics of this environment that we have, the digital environment, has the capacity and capability to become completely literate. So I'm going back to words that have been used by Christine and Nick, and that is about trust. We have to have trusted partners that are able to mediate some things which we are incapable of doing ourselves on the level of healthcare professionals, on the level of the community that we serve. And there is 2 types of trust. There's blind trust and trust which is built on credibility and accountability. And why seemingly the process takes so long time is that it takes some time to build this trust. And if we don't start it doing quickly, then we will not be in the capacity of using the environment to its potential. So much for the participation of the professionals. My role as a healthcare professional, as a server to a certain community, has changed from somebody who is doing a service rather to somebody who is mediating or brokering data and information to a certain part of people that have spent their lives focusing on becoming literate in other areas of human activities rather than in the activity of digital health. So I see myself as a professional broker. It's the same as with my financial advisor. I have all the data about my finance. I actually have more data than my financial advisor, because if I tend to disclose or non-disclose some of my data, they have less data. But even though I'm literate and I can read all these things, I'm unable to work with the finance, so I need a broker. And that's where I see the professional's role today.
Another fantastic metaphor. I'm loving these analogies, and I think it will really help our audience to frame some of the concepts that we're discussing here. I mean, to continue, Alice, just on that broker piece, it is very interesting. As you say, you're the person who acts on the data, but it's the patient in this scenario who has all of the data. Now, I wonder, for some healthcare professionals, it's quite scary, the amount of data that's being collected, and the onus could be on the professional to have to interpret that data more than the patient. For example, if you've got trackers that are working, that are communicating with healthcare professionals, it's much different to having the appointments. You now potentially have to be looking at a continual feed of data from your patients. What would you say to healthcare professionals who have this fear that they don't want to know everything all of the time?
Very interesting point that you put up, Jessica. It's like eating. It's not having it all the time and stuffing everything into you. Because if you eat it all, it will probably make you sick, with all the consequences that can happen. And the same goes about data, information, and knowledge. It's having the right amount of information, which is, and that's already been voiced by Christine, it has to be valid, up-to-date, and relevant at the right time when I need it. So when I was a young physician, I had to go out and get all my data myself. And that meant the patient data, I had to use my own hands, and a digital exam was using my fingers to get the data from the community that I was caring for. All the way to getting the literature data, I had to do my own fishing in the pond of literature. Today, I can collaborate with the community that I serve. So essentially, all of this, getting the data to me, I can skip this issue because I get all of this provided by the community that I serve, and they do it better than I because they speak languages that I don't speak. They're very proficient at using some digital technologies to get the data out of the silos where they are stored. The only thing I have to do is work it out with the community that I serve, what I need, and they provide it to me, but then I have to be literate enough to be able to work with it. And that is balancing the fact. As opposed to artificial intelligence that computes results, I, as a human, weigh certain facts against the framework where I'm supposed to help somebody with a very important decision, probably one of the most important decisions concerning their health and their lives. So the reasoning has to be absolutely perfect, or as perfect as allowed in the framework of the environment that we are using. So instead of focusing in healthcare education on giving facts to my younger colleagues, I have to focus on getting this community on board to be able to work with relevant, up-to-date facts. And again, it's not about having it all. It's about having the right amount at the right time. So it's about filtering, noise canceling, shifting, pattern recognition, and all of the other advantages that informatics as a science provides us with.
Thanks, Alice. Great points, and there's so much that I want to pick up, conscious of time that we won't get through it all, but thinking about that balance and how you assess things, and you're playing a role really in empowering the individual to make informed choices. I'd like to come back to Angie just to discuss, obviously, the community that you work in dementia and Alzheimer's. As an individual living with that condition, you're not necessarily in the best position to be able to consent to the use of your own data, to interpret and use your own data, as to are often forced to caregivers. And I wonder if there's anything you can illuminate there on the challenges from a caregiver perspective in terms of engaging with health data on someone else's behalf?
So I think I would maybe make a first point that we need to be very careful not to make assumptions that people who have a particular condition are not able to do certain things. So there are very effective ways to communicate with people who have cognitive impairment, even in the mild, moderate, and maybe advanced stages of dementia, in such a way that they can be active participants in decision-making about their care. So I think the first message would be, it doesn't all have to be delegated to caregivers, and everyone is an individual. Everyone's experience of dementia will be very unique to them. And there are processes in place to enable supported and shared decision-making. And those decision-making processes should engage family members and people who know and love the person who has dementia and is experiencing cognitive decline. So obviously it's not just important to educate the person with dementia in aspects of digital health so they can be empowered. It's also important to engage family members and caregivers. And I think doing this early is key. We need to ensure that systems for education and awareness are really embedded, not when people have established diagnoses of disease, but that these are conversations that are had well in advance, so that people can be prepared and also manage their conditions much better, and to help family members play a meaningful and beneficial role in helping their friend, loved one, manage their condition. So it's really a whole spectrum of awareness that's needed. And as such, all different members of different communities need to play a role in that. So it can be healthcare professionals, it can be caregivers, it can be professional carers in the home, it can be patient associations who deliver messages. Governments need to play a role in mandating their health ministries to focus on people who may not be, I don't like the term easy to reach, because we shouldn't label a community or a type of person as hard to reach. It's up to us to ensure that we use the correct channels to reach them. There are gatekeepers to different communities, apologies, and we need to be aware of those gatekeepers and use appropriate communications that are tailored to meet their needs. And that's essential. It's an imperative. It's not a nice to have.
Thanks, Angie. Again, so many things that we could explore in depth. Just have a focus on one of those areas and spend an hour on that. I think the point around education before you're in a position where you're being asked consent is key. That's what Data Saves Lives is all about. And lots of our communication, we don't talk about patients, we talk about citizens, because each and every one of us is engaging with the topic of health, whether you're in a state of ill health or not. Your health is something that's with you all the time. Christina, what's been your experience of embedding health literacy in the way that literacy is part of school curriculums at a young age, but we don't talk about health so much? Have you been involved in conversations with policymakers and boards about how that might change?
So yes, we know that health literacy develops over a lifetime and also differs according to what kind of life events that we encounter. And therefore, there is now a focus on improving what was old school health education to actually now embrace also the concept of health literacy, to make sure that our new generations not only have the right knowledge, but also the capacity or the competencies to actually being able to act. And you can see it with many examples. So, for example, the Fitbits and all these new apps and so on, that generates data, and you want people to act on these data. But we hear that for some people, it almost generates a data stress, because they get so excited about the data and they want to take 10,000 steps a day, and they find themselves walking up and down the stairs in the middle of the night to reach those 10,000. And that's where it takes them too far. So we want to, as part of health literacy, to make critical thinkers. And that's why I'm so excited that in many countries, they now choose to include health literacy as part of school curriculum, so that we can judge and balance things and not be over the top on stress, and also make sure that we are not being misused. And you see that from, use of social media, that it's designed in a way that it will trigger you to spend too many hours on certain things that are not healthy for you. So if we can educate them.
Thanks. I know we've all been lost in the scroll.
Make the choices and balance it. That would be great.
Sorry, Christina, I spoke over that last point because we lost you. So I might just ask you to repeat that last bit again.
Sorry. I'm just saying I'm very excited that the new generations will have health literacy as part of the school curriculum so that they can balance all the challenges and opportunities that we see to improve health.
Thanks, Christina. Alice, you have something to add on that?
Yeah, I have a very short comment to Christine. It's not about knowing. If you know something, you can use it in the same situation. So you can do a repeat. It's about understanding. And that is, it's a little bit more difficult to achieve understanding than knowing. For example, we've learned at school that the sum of angles in a triangle, the internal angles, is 180 degrees. But then you get one more dimension, you get a curved triangle. So it's not in the flat space anymore. And the sum of angles of that triangle may be less than 1 degree or more, depending on hyperbolic space or spheric space. And because the digital environment changes and shifts very quickly, Google yesterday was different from Google today. It's about learning the basic principles of the environment rather than just knowing how to use a certain tool or how to use a certain communication channel. And that happens by somebody who sheds light into a black hole and the others try to see the advantages of what is in store.
Yeah, I fully agree. And that's why also in our definition, we say it's about getting access to information, understanding it, actually being able to judge if this is relevant for you, for what you're doing, and whether you can then take that knowledge and apply it. So I fully support your point.
Thanks, Christina. Thanks, Alish. And Nick, before we head back to the live studio, as it were, are there any comments that you'd like to make from a policy perspective of some of the things that you've heard from your other panelists?
Yes, thank you very much. Well, I couldn't agree more with what I just heard. And I think navigation will be key. I had the analogy at the beginning with the transportation system, where you also need to have a map. You need to know where to go next. And I think the same will also be applicable to digital health. We will need to know what happens to our data if we give the data to a certain player. In the end, we will also need, and now I'm talking from the other side, from data user sides, we will need to know how to navigate, how to get access to what kind of data for research purposes, but also for research and development. We're always talking about artificial intelligence, but artificial intelligence in the end is training on large amounts of, in our case, health data. And for the user itself, it's not relevant from whom that data is. It's not relevant that that data is from Jessica Pacey, from Aleš Borek, Christina Soros, and Nick Schneider. But it's relevant that the data is well curated, it's annotated, has high quality, and leads to reliable results. And I think we need to move the narrative away from AI is taking away our private data to abuse it and see what is the use of that data and what can we learn from it. And at the moment we see, especially medical technology, that a lot is trained on data from Asia, from the US, potentially in the future from Africa. Is that data really applicable to our population in Europe? Or do we need to have European training, testing, and regulating data sets to ensure that the algorithms being used in health and healthcare, used in digital health applications, are really applicable and unbiased when being used in our healthcare systems? I think that's something which we still need to think about, to work together as citizens, as patients, as healthcare professionals with the industry, with the research community to come up with a good regulatory framework which ensures that we have a trustworthy health data use. And that's, to me, is the nuts and bolts of the European health data space.
Thanks, Nick. Agreed, and that's why it is so exciting. Alish?
One more comment. We can go in the regulatory way, but I'm not sure if you've noticed the activity of Tim Berners-Lee, the one who made the protocol for the World Wide Web and allowed all of this that we are doing today. But essentially, he is building something which is called the Solid. You can go solid.org and find out that there can be a protocol that allows people to build their own silos and then decide which data set to share with whom and have it totally under control. So we can, instead of building centralized repositories, using the fundamental ideas of this person that I've already demonstrated as extremely useful and that have never been licensed and nobody has profited on them apart from the whole society, we can probably try thinking about going this way of allowing people to really have things in their hands without using too sophisticated technologies, just by instrumenting the right, let's say, protocol. Another example, Wikipedia is a phenomenal collaboration. When it started, everybody said it's lay people making it, so it's not going to be as relevant as Encyclopedia Britannica or the other professional encyclopedias. And it's turned out otherwise, because somebody wrote a perfect code of conduct for collaboration in this issue. If we have a perfect code of conduct for sharing of data, then we might be able to achieve things which the environment really allows us to do in today's infrastructure.
Fantastic examples, and a lot of the ambitions of Data Saves Lives is to capture exactly that, because you hear in the press where it goes wrong and individual private data is revealed, but actually that is the minority of the cases. In the majority of cases, it is anonymized, it is being used for wider societal benefit. So it's just important that people see the good as well as the bad and to make those informed decisions. Now, Angie, I know you had a point that you wanted to add there.
Yeah, so I mean, I would echo a lot of the points that the other panelists have just made and just raise a couple in relation to that. So we talk about trust and trustworthiness. So trustworthiness is a property of a technology, and trust is something human. You trust something or someone. So I think as much as we talk about data and sharing and anonymization, pseudonymization, we need to make sure that the human dimension is still reflected, because we've seen with the pandemic and recent data scandals, the potential for misinformation to have a devastating impact is huge. So we need to get people on board from the beginning. And another aspect that I think comes with this is the human dimension, again, of what impact will these technologies have on the doctor-patient relationship. So when we were younger, currently most of the most trusted person with regards to health data, apart from ourselves, in surveys is usually the primary physician. So we are used to having a one-to-one relationship with a human doctor. I don't think that's going to change. I don't think we're going to be dealing with robot doctors. However, AI will increasingly be a part of the doctor-patient relationship. And we need to be really careful in addressing what the impacts of AI on the doctor-patient relationship will be, and make sure that both parties are comfortable with that, not just doctors, but also patients.
Thanks, Angie. Completely agree. And in fact, that might be something that we can explore immediately now. But before we do, I think it's probably best that we hand over back to live so we can see if there are any questions from the audience that have come in that we want to continue in this panel. And if not, we can return to a lot of those topics that are in full discussion now. So that's me handing over to future me. Thanks very much. So now back live in the room, we've got the panel and we've got a couple of extra guests who you saw earlier on in the session. So Birgit is now with us to close the session, our panel discussion. And I'd also like to introduce you to Sheila, who will introduce herself. Now, Sheila actually has come on to support and be one of the first testers of the Data Saves Lives toolkit. So Sheila, as well as introducing yourself, can I ask you to speak around what motivated that initial discussion around the toolkit and how you found using it?
Well, thank you for introducing me. My name is Sheila. I'm a patient advocate, and I'm also the chair of WAPO, which is the World Alliance of Pituitary Organizations, based in the Netherlands. Now, the Data Saves Lives toolkit came around when Birgit introduced me to the idea. And immediately I was attracted to the toolkit because I said, this is already something that the patient community can use. And although I was very enthusiastic about it, as we are an umbrella, a global umbrella organization, I immediately saw red flags coming up, which meant extra work for us and meaning extra challenges for us. As a global organization, we are acutely aware there are two factors which impact the participation in any kind of activity. One of them is language. So we would have had to adapt the toolkit to the community that we would consider the most needy. In our case, it would be Spanish in Latin America. And then, of course, finding the right active patient advocates or ambassadors, as you wish, who would be introduced to the toolkit and who would then have the responsibility of speaking to the community and then caregivers, et cetera, et cetera. But I am enthusiastic about it, and I will definitely involve the board more into this, and then eventually maybe do something for our summit, which is next year.
Thank you so much, Sheila. And it's great to highlight some of the challenges with language. We've explored it in today's discussion earlier around improving health data literacy. And certainly that's something that we want to work on as the initiative continues next year and beyond. For anyone who hasn't seen it in the exhibition booth over the last 4 days, then we have got the toolkit available. So please do check it out. And outside of this Congress, we also have it on the Data Saves Lives website. So we hope you can find that useful as you continue on your own health data journey and supporting the organizations that you work with. Now, there has been a huge amount of chat going on in the side alongside the session, which has been wonderful to see. And I think testaments to this Congress and how relevant the talks have been, and how hopefully this will be encouraging people to expand their network and continue these conversations offline. Conscious that we have about 5 minutes left of the session, so what I'd like to do is invite each panel participant to share an answer to a tricky question, which is next year. So we're entering 2022 or looking ahead to next year. What would be the biggest single change or event or opportunity that you can think of which would have the biggest impact in terms of improving trust in health data and health data use amongst the public? Now, Nick, I'm going to come to you first for your view on that.
Thank you very much, Jess. Well, for 2022, I think the key issue will be transparency for an in-depth understanding on what really happens with our data. And to my mind, the toolkit is a very good start, but it needs to be then tailored to the respective local needs. And I think that's something which we should all work on in the next year. In the middle term, however, we will not only have to rely on the toolkit as something coming from the EPF and the patient side, but I think we will need supporting regulatory technology, so-called RegTech, to ensure citizen-centered data use. We might need, as I said earlier, the digital navigation skills. And maybe we also need some kind of a safety belt to ensure a safe citizen or patient journey when traveling through the European health data space.
Thanks, Nick. As you've shown in the first answer, it's not as simplified as we thought, but I think transparency is a key takeaway. And as you say, technology is going to be the future when it comes to regulation here. Christina, can I ask you the same question? What one change or opportunity would you see as having the biggest impact?
Yeah, I think the change we will see next year is that we will start reflecting on the lessons learned from the pandemic. We are already, but we're still in the pandemic. And I think next year we will have a much clearer view on how is it now how is it developing in the European region? We will have the third shots, many of us. How is it impacting the flu waves and other diseases, the economic impact? And I think then learning from those new data that will be available and all the research that has been generated in the past 2 years, I hope will take us to the next level. And we will clearly see which countries did well politically, economically, in terms of trust, and what are then the lessons learned. And that can drive then the next generation of data, but also behavior, and hopefully also build the trust that we want our citizens to have in the political system and EU. Thanks.
Completely agree, and thank you, Christina. The pandemic has certainly shifted citizen focus and awareness of health data. So let's see with the first winter post-vaccines what the world is looking like. Alish, same question for you for 2022.
You always ask difficult questions, but I think that the challenge that we have is to understand that trust was always built on like-minded communities. So basically on the ownership of what is being done. And I think that our biggest challenge is to take the advantage of face-to-face communities and the online communities and actually build collaboration on a certain product where people feel the ownership. And if they feel the ownership, then this results in a trust between all the people that are doing this community work. So I think it is about communio, building communities and using the advantages of what last 2 years has offered us with platforms for digital communication that have really made a vast advance, because we've been going on for an hour. It's a mix of pre-recorded and online, and it's due to the people that are behind the scenes is functioning seamlessly and has the ability to help build a trustful community. So that's where I see the options of next year, continuing the build of communities.
Thanks, Alish, and completely agree. We have seen an amazing digital community here at the Congress alone, so very important for us to continue those conversations. Angie.
Wow, it's hard to follow from such good insights from my panel colleagues. So I think what I'll try to do is maybe take a step back from data and digital literacy and maybe address the point of stigma. So we're talking about health data as if conversations around health and disease are easy ones that people find very unchallenging to engage with, but that's not the case. There is still a lot of stigma around many conditions, many disabling diseases and conditions. And that's something that we really need to address so that people engage in conversations around health and are engaged in conversations, therefore, around health data as well. So building on the key tenets of trust, community, transparency, and communication, I think we need to really address the fundamentals of stigma.
Thanks, Angie. Such a great additional point to make there. We've got two more panelists I'm going to challenge with this question, and I'll come to Birgit last, actually. So Sheila, let me come to you.
Right. So I was very struck by what Alish said, understanding before knowing, which leads me to say that it is important that we start thinking about those who are not involved in health. So the citizens at large who have no health problems, and they are the ones who really need to be involved in order to understand the value of health literacy, and then they will start using the data and understand the value of that. So have a much wider spectrum than just focusing on patients, because there's a whole thousands, millions of people who are not involved in this because they don't need to, but there's great value in how they can contribute and understand and use.
Absolutely, and engaging different communities is the way to that. Now, Birgit, as our Data Saves Lives stalwart, we have less than a minute before we conclude this session. So I'd like to hand over to you. I'd like to thank all the panel, of course, for their efforts today. And Birgit, what are your concluding remarks for 2022?
Thank you for all the arguments and the interesting discussion. I couldn't agree more with you all because it's so important. I would say let's move on with Data Saves Lives, bring it to the people, join the discussion and come to us and discuss with us because it's important.
Thank you. What a message to end on. And in 15 seconds. So thank you all for joining. Please let's continue these discussions. And as Birgit said, let's continue having Data Saves Lives.
Have a great day.